Federal employees and retirees approaching age 65 are often unclear as to how the various parts of Medicare work with their FEHB plan. The part of Medicare that usually generates the most questions, though, is Medicare Part B. For this reason, we'll focus on Part B in this video and how it relates to the FEHB program for both active and retired employees. First, let's go over a brief history of Medicare. Back in 1965, Medicare was signed into law and provided major medical coverage for those aged 65 and over. Several years later, people with certain diseases and disabilities under age 65 became eligible to enroll. Medicare began with two parts, Medicare Part A and B, now known as the original Medicare. As our healthcare system evolved over the years, two additional parts of Medicare were added. Part C was signed into law in 1997 for those who wanted to enroll in regional managed care plans. And Part D, for prescription drug coverage, was signed into law in 2003 and became effective in 2006. Those of you nearing age 65 may already have some experience with the original Medicare because of your parents. You likely already know that Part A is premium-free and Part B requires a monthly premium. The most popular question among federal employees nearing age 65 is, should I enroll in Part B or not? And the answer is a resounding, it depends, on several factors. Not the answer most people want to hear. You'd be in good company, though, if you did take Medicare Part B, because 93% of Americans who are eligible decide to enroll. Many people refer to Part B as the doctor portion of Medicare, but it's much more comprehensive than just coverage for outpatient and inpatient doctor visits. Part B covers services at 80% with an annual deductible. Along with doctor visits, Part B covers outpatient hospital care, outpatient diagnostic tests such as X-rays and laboratory tests, durable medical equipment and supplies, physical and occupational therapy, ambulance transportation, and other outpatient services. Because premiums for Part B have steadily risen over the years, and since premiums are now based on income levels, the decision takes a little more thought and calculation for some federal retirees. As of 2007, the monthly premium became means-tested and based on a person's adjusted gross income. The nonpartisan Kaiser Family Foundation recently determined that 95% of beneficiaries pay the standard monthly premium. Those with incomes over $85,000 fall into one of the four income-banded monthly premiums seen here. Because income brackets were held at 2010 levels until 2019, and as more baby boomers become eligible in the coming years, it's estimated that about 14% of beneficiaries will pay more than the standard premium. Many federal retirees want to know, why should I pay Part B premiums every month when my FEHB plan covers these same services? Well, there are some big advantages for those enrolled in Medicare Parts A and B. Almost all fee-for-service plans within the FEHB program will pay the 20% that Medicare doesn't pay. Those same plans will waive their deductibles and coinsurance for most medical services. They typically allow you to see any provider that accepts Medicare assignment anywhere across the country without referrals, even those providers outside the plan's network. Some plans even pay for medical services when outside the U.S., something Medicare doesn't cover. Also, most fee-for-service plans will coordinate with Medicare electronically, so you won't have to file paper claims after going to the doctor or hospital. For many people, all these factors add up to peace of mind and a greater sense of security in retirement. For others, it may just be a matter of dollars and cents. It really depends on you and your family's needs. If you decide not to enroll in Part B and you're enrolled in a fee-for-service plan within FEHB, you will likely have to pay your plan's deductible, copays, and coinsurance amounts up to the plan's yearly catastrophic limits. If acute care is needed in any given year, it may translate into several $1,000s out of your pocket. You should compare these out-of-pocket costs to the amount you'll pay for Part B premiums for you and your spouse per year. You should also consider you and your spouse's health status in the years preceding age 65. An interesting NIH study shed some light on when our healthcare dollars are spent during our life cycle. The results show that on average, we spend more than half of our healthcare dollars in our golden years. And when longevity is on our side and we live to 85 years and beyond, 2/3 of our expenditures will come after age 65. If you decide not to sign up for Medicare Part B when you're first eligible, you may be charged a late enrollment penalty. The penalty is 10% of the premium for the first year you do not enroll and is permanent. For every 12 months you are not enrolled in Part B, the premium penalty increases in 10% increments. There's one big exception to this rule, though. When you turn 65, the late enrollment penalty doesn't apply if you are enrolled as an active employee under FEHB or are covered under your spouse's group health plan and he or she is an active employee. In this case, it doesn't usually make financial sense to enroll in Medicare Part B just yet because your health plan is still considered the primary payer. Once you or your spouse stop working or are no longer covered by the group plan, you'll have an opportunity to enroll without a penalty during a special enrollment period. This 8-month time frame begins the month after you retire. You also have the option to enroll at any time while you are covered by the group health plan. In the Medicare section of all FEHB plan brochures, you'll find the primary payer chart. This detailed chart outlines when Medicare is primary or secondary according to your employment status and other factors determined by Medicare. And on the next page, you'll find complete details on how FEHB plans are required by law to pay providers when you are 65 and older and are not enrolled in Medicare Part A, Part B, or both. It also outlines how plans are required to pay physicians that do not accept Medicare assignment. The vast majority of doctors, though, do accept new Medicare patients. Another study that Kaiser Family Foundation conducted recently found that on average, 91% of physicians accept new Medicare patients nationally, with Florida leading the pack at 98%. And less than 1% of physicians in patient care have officially opted out of Medicare. We've covered a lot of information about Medicare Part B, and there are probably some special situations out there that we didn't have time to cover. Your best and most accurate sources of information on all things Medicare are the Medicare.gov and SSA.gov websites. To learn more about Medicare Parts A, C, and D, and how to enroll in Medicare, go to youtube.com/GEHA Health. You'll also find a short video on how GEHA health plans work with Medicare in retirement and how our FedVIP dental plan can help reduce your dental expenses. You can also find us on Facebook, Twitter, and Pinterest, where you can discover great recipe books, healthy lifestyle advice, and updates on your federal health benefits.